Okay, let's get right into it. Prostate cancer. It's pretty sobering when you look at the stats. We're hearing it's the second most common cancer in men, just after skin cancer.
That's right. The projections are, well, quite high. Hundreds of thousands of new cases, tens of thousands of deaths expected.
Yeah, it really makes you stop and think. But here's the crucial part, the bit we really need to focus on. Catching it early makes a massive difference in outcomes.
Absolutely. That's the positive angle here. The potential for early detection to completely change the story for someone is huge.
Exactly. And that's what this deep dive is all about. We want to help you understand those early warning signs. Think of it as getting equipped with knowledge.
Drawing on what the experts say so you can be informed, proactive.
And, not fall into that trap of being stubborn, ignoring things, that head in the sand approach. It just doesn't work with health.
No, it really doesn't. We see it often, though. Men sometimes chalk things up to just getting older, right? Subtle changes get dismissed.
Yeah, exactly. So our goal here is just to lay out the information, help you spot when something might need a closer look.
So let's start with the basics. The prostate itself. What is it? What does it do?
Good idea. Okay, so sources like First Stop Health and Dr. Eric Berg describe it as this gland sits right under the bladder. Dr. Berg uses the comparison walnut-sized, which is helpful.
Right, and it wraps around the urethra, that's the tube urine flows through.
But that's main job. It produces seminal fluid. The fluid part of semen, crucial for ejaculation.
That's a good summary. Understanding that location and its role in producing that fluid helps make sense of why problems there cause certain symptoms. It's all connected.
Okay, groundwork laid. Now let's get into the 10 key warning signs. We're mainly drawing from First Stop Health for this list.
But we'll also pull in some insights from others like Dr. Rena Malik, a urologist, and Dr. Berg for that nutritional angle when it fits.
Yep. And just to reiterate, the goal here isn't panic, it's knowledge. Power through information. Ready to jump into sign number 10?
Let's do it. Context is everything with these signs.
Okay, number 10. Painful or burning urination. So if the prostate gets enlarged because of cancer, it can squeeze that urethra tube.
Making it painful or causing that burning feeling when you go, that mechanical pressure is definitely a factor.
It's not just pressure, is it?
No, the cancer itself could actually invade nearby tissues, the urethra, the bladder wall, even the rectum. That direct invasion can cause irritation, pain.
So two potential causes right there, obstruction and invasion.
Exactly. And the type of pain might even feel a bit different. Obstruction might be more discomfort with a weak stream, while invasion could be a sharper, more constant burn. Subtle clues.
And there's another possibility too, infection.
Right. If urine isn't emptying properly, like if there's retention from a blockage, that can become a breeding ground for bacteria, so you might get a UTI on top of everything else.
Or it could even be a side effect from treatments.
Precisely. Treatments can sometimes irritate the urinary tract. So yes, antibiotics might clear an infection temporarily, but you still need to figure out the root cause, the underlying prostate issue.
And things like obesity might make these symptoms worse.
Yes, Dr. Malik mentions the link between metabolic health, obesity, and overall urinary symptoms. It can exacerbate things.
Okay, moving to number 9. Frequent urination, especially at night, nocturia.
Ah, yes, nocturia. Getting up multiple times a night to urinate. It's more than just inconvenient.
It really disrupts your sleep, leads to exhaustion, right?
Absolutely. Poor sleep impacts everything: energy, mood, focus. If it's happening regularly, more than once or twice a night consistently, and it's bothering you, that warrants a chat with your doctor.
Are there ways to track this?
Yeah, bladder diaries are actually really useful. You just jot down when you go how much, any urgency. It helps the doctor see the pattern. Of course, other things can cause it too, like drinking too much fluid before bed or certain meds.
Good point. Okay, number 8 is blood in the urine. Hematuria.
This one definitely sounds alarming, and it can be. It often shows up in more aggressive or advanced stages of prostate cancer.
So not usually an early sign.
Not typically, no. And there's a difference. Sometimes it's microscopic, only seen in tests. Other times it's macroscopic. You can actually see it. The urine looks pink or red.
And it's relatively rare in prostate cancer patients overall.
The stats suggest around 3-5% of patients show this, so not the most common sign. But if you see blood, any blood, you need to get it checked out immediately. No waiting.
And the source of the blood might not even be the prostate itself.
Correct. If the cancer has spread, it could be affecting other parts of the urinary system. Kidneys, ureters, bladder, and the bleeding could originate there.
What kind of test do they do for that?
Usually starts with urinalysis, checking the urine sample. Then maybe urine cytology to look for cancer cells, imaging like an ultrasound, a physical exam, including a rectal exam. They need to pinpoint where it's coming from.
Got it. Sign number 7, pain in your back, hips, or legs.
This is a significant one because it often suggests the cancer might have metastasized.
Spread to the bones in those areas.
Exactly. Bone pain, especially persistent or unexplained pain in the back, hips, or legs, can be a red flag for metastatic prostate cancer. There was even a study showing a link between back pain and a higher likelihood of diagnosis.
And it's not just pain, right? Weakness or numbness, too.
Yes. If the cancer affects the spine or related nerves, you might experience limb weakness or numbness as well. These are signs of more advanced disease.
Okay, number 6. Sudden, unexplained weight loss.
Yeah, this is a general cancer warning sign, not specific just to prostate cancer, but definitely relevant.
Why does it happen?
Several reasons. The cancer itself can affect metabolism. Plus, patients might experience loss of appetite, nausea, vomiting, even changes in how food tastes, all contributing to weight loss.
So the key is unexplained.
Absolutely. If you're losing weight without trying, without changing your diet or exercise, that needs investigating by a doctor.
Right.
They might suggest nutritional support or meds for nausea if needed.
Number 5, pain in the rectum.
This often points to the cancer spreading locally, maybe the tumor invading the rectal wall.
And it might come with other bowel issues.
Yes, things like constipation, feeling like you urgently need to go, sometimes even incontinence or blockage. Significant bowel changes alongside rectal pain definitely need prompt medical evaluation.
What kind of
A
evaluation?
digital rectal exam is key. Maybe imaging, like ultrasonography, PSA screening. They'll assess the situation thoroughly.
Okay, number 4, painful ejaculation.
This can be really distressing, impacting relationships and self-esteem. It's called dysorgasmia.
Is it common?
Not hugely common with prostate cancer itself. Maybe around 2-3% of patients experience it, according to the source, but still important.
Does it happen during or after?
It seems it's more common after ejaculation, but can sometimes occur before as well. Any persistent pain related to sexual activity should be checked out.
Right. Number 3, pain while sitting.
This makes sense anatomically. If the prostate gland is enlarged, whether it's BPH or cancer, it can press on nerves and tissues in that perineal area.
The area between the scrotum and anus?
Exactly, causing discomfort, maybe even numbness, especially when you're sitting on a hard surface for a while.
Is there a specific type of prostate cancer linked to this?
The source mentions adenocarcinoma, which is the most common type, is often associated with this symptom. Pelvic or lower back pain while sitting can also be related.
Number 2, problems urinating. Difficulty going.
This is often due to urinary retention not being able to empty the bladder fully. It can become difficult, slow, or even impossible to start or maintain a stream.
And again, caused by that enlarged prostate or tumor invasion.
Yes, those are the primary culprits obstructing the flow. Difficulty starting, straining, a weak stream. These are all signs that need a urologist's attention quickly.
And finally, number 1, loss of bladder control. Incontinence.
Right, urinary incontinence. This can really affect quality of life. The symptoms might vary too.
What kinds of incontinence?
Stress incontinence, leaking when you cough or laugh, and urge incontinence, that sudden, strong need to go, are common forms mentioned.
Can this be a sign that cancer is progressing?
It can be, yes, but it's also, importantly, a potential side effect of treatments like radiation or surgery, prostatectomy, where nerves controlling the bladder might be affected.
Because the prostate itself helps regulate urine flow.
Precisely. Its location and function mean that problems with it, or treatments for those problems, can easily impact bladder control. It's actually quite common post-treatment. Maybe around 25% of men experience some level of it.
Wow. Okay, so those are the 10 signs. But a really critical reminder, many men, especially early on, might have no symptoms at all.
That is so important to stress. You can't rely solely on symptoms appearing. That's why screening and knowing your risks are vital.
And just because the prostate is enlarged doesn't automatically mean cancer, right? Benign enlargement, BPH, is very common with age.
Very common. Dr. Berg makes that point too. It's crucial to differentiate.
Let's quickly recap those key risk factors then. Older age.
Yep, risk goes up significantly after 50. Race is another factor.
Black men have a higher risk and potentially more aggressive cancer.
Yes, sadly. The reasons aren't fully understood, but the disparity is clear and underscores the need for awareness and screening in that population.
Family history.
Huge. A father or brother with prostate cancer increases your risk. Also, family links to BRCA genes or significant breast cancer history.
And obesity.
Obesity seems linked not just to potentially increased risk, but possibly more aggressive cancer and recurrence. Dr. Malik connects it to metabolic syndrome too, diabetes, high BMI, waist circumference, increasing BPH risk as well.
So what about prevention? Can anything be done? Diet seems to come up.
A healthy diet is always recommended. Lots of fruits, vegetables, whole grains. That Mediterranean style Dr. Malik mentions seems promising.
What about lycopene from tomatoes?
There's some buzz around it, especially cooked tomatoes for better absorption. But Dr. Malik advises caution. It's not a magic bullet. Research is ongoing, and too much might not be good either. Think broader dietary patterns.
And exercise.
Definitely. Regular activity, even just light activity, seems beneficial. Maintaining a healthy weight ties into this too. Managing metabolic health, weight, blood sugar, cholesterol is key.
Dr. Malik also warned about some OTC meds.
Right. Things like certain antihistamines or decongestants can sometimes worsen urinary symptoms if you already have BPH. Good to be aware of.
Okay, and Dr. Berg brought up zinc. That was interesting.
Yeah, the idea that the prostate has this incredibly high zinc concentration and maybe deficiency is linked to enlargement or even cancer.
He suggested zinc might inhibit that enzyme, 5-alpha reductase, that converts testosterone to the more potent DHT.
Exactly. DHT is a major driver of prostate growth, so anything that influences its levels is potentially significant.
And he listed reasons for deficiency diet: low in red meat, shellfish, grains blocking absorption, low stomach acid, certain meds like antacids or statins, alcohol, sugar.
A whole range of modern lifestyle factors, potentially.
But he also stressed it's not a cure-all.
Absolutely. Zinc is likely one piece of a very complex puzzle. Supplementation isn't a guaranteed fix. Many things are involved. But considering dietary and lifestyle factors that impact zinc is part of a holistic view.
So across the board, the main advice is regular checkups.
Without a doubt. Especially if you have risk factors. Screening is the cornerstone of early detection. Cannot stress that enough.
Okay, let's wrap this up. Being aware of these 10 signs, crucial first step. But remember, lots of things can cause similar symptoms.
Right. Don't panic, but definitely don't ignore persistent red flags. That stubborn approach won't help.
Talk to your doctor. That's the bottom line. Early detection drastically improves the outlook for prostate cancer.
It really does. Prompt evaluation is key.
So here's a final thought for you listening. Reflect on these signs, these risk factors. Do any resonate with you, or perhaps with the men in your life? What's one proactive step? Maybe a diet tweak? Maybe booking that checkup that you might consider after hearing all this?
Yeah, taking that moment for reflection, then taking action. That's what makes the difference, taking ownership of your health.
Couldn't agree more. Thanks everyone for joining us for this important deep dive into men's health. We really hope this empowers you.
Stay informed, stay proactive.